I am a urologist specializing in male longevity and reconstructive vascular health, and I am consistently frustrated by a silent, mechanical error that millions of men commit every single morning when they get dressed. We are conditioned to spend thousands of dollars on therapies, exotic diets, and synthetic pills to optimize our testosterone and restore our erectile function. Yet we completely ignore a daily habit that is actively suffocating the pelvic floor. I am talking about an innocent wardrobe choice that acts as a continuous, low-grade tourniquet, physically crushing your microvessels and inducing thermal damage to your hormonal machinery for 12 to 15 hours a day. In my clinic, I see men every week suffering from unexplained pelvic ache, declining testicular volume, and a sudden, frustrating softening of their erections. They inevitably think it is just stress or an unavoidable symptom of getting older. By the end of this video, you will understand exactly how the physical compression and thermal trapping of your underwear is strangling your vascular supply. And I will show you how to reverse this localized tissue damage before the fibrosis becomes permanent. To understand why this is a true clinical emergency for your pelvic health, you have to look at the precise anatomical engineering of the male reproductive system. Your testicles are located outside of the body cavity for a critical, non-negotiable biological reason: thermoregulation. For your Leydig cells, the cellular factories that produce your endogenous testosterone, to function optimally, they must remain approximately 2 to 3 degrees Celsius cooler than your core body temperature. Furthermore, the massive network of veins in the scrotum, known as the pampiniform plexus, relies on gravity and mechanical freedom to drain deoxygenated blood away from the pelvic floor. When you wear tight, synthetic underwear, such as modern briefs, restrictive boxer briefs, or heavily blended polyester fabrics, you introduce two catastrophic variables: thermal trapping and continuous mechanical compression. Synthetic fabrics do not breathe. They act like a greenhouse, trapping body heat and moisture against the skin. When your testicles overheat, the Leydig cells experience immediate oxidative stress, and the production of testosterone plummets. Your body actually shuts down the hormonal assembly line to protect the tissue from thermal damage. Simultaneously, the continuous physical pressure against the perineum creates mechanical compression. It acts like a rubber band wrapped loosely around your finger. It does not stop the high-pressure arterial blood from entering the penis, but it severely restricts the low-pressure venous blood from escaping. This results in venous congestion. The blood becomes trapped, stale, and deoxygenated, creating a hypoxic environment in the pelvic floor. When tissues are deprived of oxygen, they trigger an inflammatory cascade. This is the exact reason why reaching for a synthetic erectile pill while wearing restrictive clothing is biologically illogical. You are attempting to forcefully pump more blood into a system that is already chronically congested and suffocating. To stop this mechanical strangulation and restore deep, oxygenated blood flow to your reproductive organs, the very first intervention is not biochemical, it is physical. You must transition your daily wardrobe to loose-fitting 100% organic cotton or bamboo boxers. These natural fibers are highly breathable and possess moisture-wicking properties that prevent thermal trapping. More importantly, loose boxers restore the mechanical freedom of the cremaster and dartos muscles. These are the muscles that naturally contract and relax to raise or lower the testicles, perfectly regulating their temperature throughout the day. By giving them physical space, you allow your autonomic nervous system to manage your hormonal temperature without interference. Secondly, you must implement a protocol of nocturnal vascular release. This simply means you must sleep entirely naked. The 7 to 8 hours you spend in bed are the most critical window for vascular repair. During REM sleep, your parasympathetic nervous system triggers nocturnal erections, which serve to oxygenate the cavernous tissue of the penis and prevent scarring. If you sleep in underwear, especially ones with elastic waistbands, you disrupt the natural lymphatic drainage of the pelvis. Removing all physical restriction at night allows the deep dorsal veins to completely decompress, clearing out the metabolic waste that accumulated during the day and maximizing unhindered arterial inflow while you heal. Third, you must actively force the stagnant blood out of the pelvic floor using a targeted thermal contrast technique. At the end of your daily shower, expose your pelvic region to pure cold water for 30 to 45 seconds. The acute cold exposure violently stimulates the cremaster muscle, causing it to rapidly contract. This mechanical squeezing action acts like a biological pump, flushing the trapped, deoxygenated venous blood out of the scrotal sac and making way for a fresh, highly oxygenated arterial surge once you step out of the shower. This simple daily habit drastically reduces pelvic inflammation and restores vascular tone. If you believe this level of precise, mechanical understanding of your anatomy should be the standard of care, rather than a doctor simply handing you a prescription and telling you that a declining sex life is part of getting older, please take a moment to like this video and subscribe to the channel. It allows me to keep bringing this vital clinical truth to the men who need it most. For a long time in my clinical practice, my approach to this specific type of vascular congestion was entirely behavioral. I told men to change their underwear, sleep without them, and utilize cold exposure. I aggressively resisted the idea of biochemical supplementation for what I viewed as a purely physical compression issue. I assumed that once the physical restriction was removed, the body would naturally right itself. However, I faced a severe physiological roadblock with my patients. While the mechanical changes relieved the physical ache, the men who had spent decades wearing tight, synthetic clothing had inflicted lasting oxidative damage to their Leydig cells. The physical factory was no longer compressed, but the cellular machinery remained sluggish and unresponsive. Their testosterone levels and vascular volume simply were not bouncing back. This forced me to dive deep into the clinical literature to find a way to biochemically rescue these suppressed cells. After extensive evaluation, I found a specific clinical-grade formulation that I now integrate into my protocols for these exact cases. It utilizes a highly standardized extract of Tribulus terrestris. This compound does not introduce artificial hormones. Instead, it directly stimulates the pituitary gland to release luteinizing hormone, or LH. This sends a massive, renewed chemical signal straight to the Leydig cells, commanding them to restart endogenous testosterone production after years of thermal suppression. It pairs this with a pure extract of saw palmetto, which actively blocks the conversion of your newly produced testosterone into DHT, thereby relieving glandular pressure on the prostate and further reducing pelvic congestion. When I started integrating this specific combination for patients in their late 40s to mid-50s, men who spent 10 hours a day sitting at office jobs in restrictive clothing, the clinical shift was profound. Within roughly 12 to 14 days of consistent use, they began reporting a return of dense morning rigidity and a noticeable restoration of testicular fullness. It is a highly precise, clinically targeted nutritional support, completely free of synthetic chemicals or unverified proprietary blends. I have placed the link to the exact formulation I recommend in the pinned comment of this video, so you can evaluate the mechanism and the laboratory purity yourself. When you finally realize that the physical choices you make are either suffocating your anatomy or allowing it to thrive, your entire approach to longevity changes. Ignoring this chronic mechanical compression does not just ruin your performance in the bedroom. Over time, that constant state of low oxygen in the pelvic floor leads to the calcification of the microvessels and the permanent scarring of the smooth muscle tissue. The temporary shrinkage and ache you experience during a long workday eventually becomes a permanent structural loss of size, capacity, and hormonal drive. The men who learn to remove physical restrictions and provide their hormonal axis with the correct biological rescue do not just recover their erectile function. They fundamentally protect their long-term prostate health, improve their daily energy levels, and regain a sense of robust physical confidence. In the clinic, the difference is visually undeniable. Men who proactively manage their pelvic vascular health age with vitality and strength, while those who ignore the mechanical realities of their own bodies slowly watch their physical capacity fade away. To summarize, you cannot chemically outwork chronic physical compression. You must free your pelvic floor by choosing natural, loose-fitting fabrics, sleeping without restriction to allow lymphatic drainage, and utilizing cold exposure to flush stagnant blood. I want to hear from you. Tell me in the comments, what style of underwear have you worn for most of your adult life? And have you ever noticed a dull pelvic ache or loss of fullness after a long day of sitting? The biological window to reverse thermal and mechanical damage is open right now, but your Leydig cells and pelvic endothelium will eventually undergo permanent scarring if the hypoxic state is ignored year after year. The targeted nutritional support I mentioned earlier is the biochemical catalyst your tissues need when mechanical changes alone are not enough to restart a system that has been suppressed for decades. The link is in the pinned comment for you to review at your own pace. Remember, treating the physical and cellular root of your vascular suppression is what preserves your manhood for the next 30 years, while merely masking the symptom with a synthetic pill only covers up a dying engine.